Hello, welcome to our presentation titled Are You Being Recorded? By Dr. Shirin Mishra and Dr. Benjamin Costa.
So to explain the purpose of our project, we realise that staff members are frequently involved in being recorded by patients, however are unaware of the legality and guidelines surrounding this. Contrary to popular belief, patients do not require our consent to record, and it is legal. Our research question is to establish whether this ambiguity could be contributing to conflict within the clinician-patient relationship, or whether there is another explanation for conflict. In terms of the method, step 1 was an electronic survey to gather both qualitative and quantitative data surrounding how prevalent this issue was amongst staff, their baseline knowledge, and if they felt their therapeutic relationship was affected. Step 2, we examined the results and presented locally. Step 3, we engaged in a deeper examination, including thematic analysis of the written transcript provided by staff members. Step 4, we will engage in local staff focus groups and will delve deeper before finally generating a report in step 5.
So this highlights some of the main findings so far. So we found that 55% of respondents to the survey had been involved in an episode where they'd been recorded, with around 50% being aware at the time that they were being recorded. What's striking is that 85% of respondents had incorrect knowledge regarding the law and local guidelines around being recorded. And over half reported that it negatively affected both their relationship with their patients and their well-being. The good news, however, was that 95% of respondents felt better informed after having taken the survey, and 98% said that they would consider it going forward in their future practice. This next slide highlights some of the examples of quotes which came out in the qualitative data, which you can read for yourselves there on the screen. Overall, the tone of the comments was very negative. The main emerging themes that we've identified in our preliminary analysis include staff feeling very threatened and intimidated by being recorded, feeling mistrusted and criticised and picked upon, and also a lot of anxiety around fear of footage being uploaded to social media, causing staff undue stress. There were some examples of staff not being worried because they were confident in their professionalism and in the practice that they'd demonstrated, but overall the content and the tone was predominantly negative.
So in conclusion, as well as the quantitative feedback, which summarised that clinicians are largely unaware of the legality and guidelines and that there's ambiguity around this, in relation to our research question in particular, the qualitative data highlighted that this ambiguity did indeed lead to conflict within the clinician-patient relationship. However, there were also other explanations for conflict, including that clinicians fundamentally disagreed with the legal stance on this issue. On a final note, during this time, when technology is commonplace and is becoming more and more common, this topic warrants a deeper exploration, including to gather data on the patient perspective and to examine the other mental health trusts.
Thank you very much for listening. Our contact detail can be found there if you wish to get in contact with us about this project.